treatments, or basically antibiotics, is not matching up to the development of resistance amongst the various microbes. So you find the bacteria becoming resistant, but we are not developing new medicines at the same fast rate.
In the approach in combating antimicrobial resistance, we are using the One Health approach where everyone is involved. And when compared to the other conditions like cancer, cholera, diabetes, diarrhea diseases, measles, road traffic accidents, tetanus, it has been projected that all these will be, the impact won't be more when compared to antimicrobial resistance.
My understanding is that when we talk of antimicrobial resistance, these are just drugs that have become resistant to the treatment of infections caused by bacteria. And this has now become a pandemic.
Basically have caucuses or clubs at Parliament. And so we have agreed to form a network here on parliamentarians against microbial resistance. It means that we can then pick up most of the literature and recruit as many parliamentarians as possible from all groups represented in Parliament, so that we can capacity build parliamentarians and then develop advocacy messages which they can share to their constituencies, as well as for us to scrutinize several bills that are coming to Parliament.
Each time when we are in Parliament, we can be able to talk to our fellow members of Parliament to tell them what that means, especially AMR. The disadvantages of getting antibiotics and not responding to the disease.
The levels of awareness is very low. And this is one of the things we must combat. We must first raise the levels of awareness around antimicrobial resistance. We must raise it up. We must raise the profile to as many people as possible, not only the parliamentarians, but generally the citizenry.
We need to develop an advocacy plan so that we can have clear actions and take this to the national stage. We consult our communities, but we also need to take it on the national stage, because if we build an action plan, we can put billboards about these issues, we can put these messages on Facebook, WhatsApp, chain groups, and then we can take them to our national broadcasters to ensure that there is debate on these matters. And it's out of public discourse and public discussion that policy is made. So policy really results into funding, because we got to fund the policy for you to be able to realize the results. So it's that chain that we need to follow.
I think for me, politically, I think we need to give this, priority number one. Regardless of whatever people would want to, we are looking at, these antibiotics, they work. But now, if you find that you take, it's not working. So what is it? Because for us to replace these drugs that we have now, that we use as antibiotics, we need to invest in research. And to invest in research, to come up with a drug, it may take about 10 years. So I think these intervention measures that we are trying to put up, I think they need to be funded. Then from there, see to it that whatever measures that the minister has put in to counter that are achieved. I think Zambia will be a better place. Cheers.